All right, thank you so much for having me again today. I'm grateful to the organizers of this conference, and I know that you guys have enjoyed great dose of learning in the last couple of hours that you've been on this conference. I'm trying to bring up my screen now. In a second, you would have it. Um, Thank you so much. So I'm Dr. Joshua Kolawole. I'm a global transformational leadership trainer. And today we're going to be exploring mental health in leadership, the heart of nurturing resilience and building sustainable team and successes for those teams, which is the goal of any leader. And I'll be talking a little bit more from I have a background as a trained physician, so that gives me some healthy dose of knowledge to talk about stress management and mental health in a way. And please, I'll try as much as well to make it simple and make it something you can approach on your job. So make it something you can really work with. So I want to thank Inspiration School of Leadership once again. I know that you guys you're enjoying the training, the knowledge, those and all the things that have been put in place to make this conference an excellent one. And hopefully we'll get to see you more and more in future conferences. And that's the goal. But the idea is that as you keep learning year on year, it's layers upon layers of those knowledge that actually leads to full-blown transformation. So it's not just a single jolt like this that leads to transformation. You continue to expose yourself to continuous doses of knowledge, and then before you know it, you'd have leaped and scaled over time. So thank you, Dr. Riches, for organizing this. Now, I started with the concept of leadership because the goal of every leader, if you really sit them down and ask them critically, is that they want to achieve exponential greatness, exponential growth and success. That's the essence of leadership. You are in a community, you see the community in ruins, you want to turn it around and get some great results. You want to grow the people, the resources in that community, and you want to do this exceptionally well. So you need to know that some part of the people will grow exponentially great and some will just move marginally. But whatever dimension either person goes, the goal for every leader is that growth, that success. But you won't have this without a audacious vision. And that capacity to be able to transform that vision from that realm of the imagined to the realm of the visible, from that realm of the intangible to the realm of the tangible. You're made a director in a ministry. Your capacity to be able to turn that ministry around starts with an audacious vision. Because there is a dose of energy required to break that psychic barrier between the intangible realm and the implementation in the tangible realm, then we are subjected to pressure. We are subjected to stress. We have to walk. And walk is a product of force times distance. Walk is also a product of pressure times volume. So you are under pressure. You need to engage disciplined mind if you really want to achieve results. That disciplined mind needs to fight the constant battle rhythm that is required for greatness, that is required for success. You would have the fear of failure on one side. You have a lot of anxiety. You have a lot of things in the community that will resist you, that will make your mission look like an impossible goal. But you would have to build capacity for engaging that battle rhythm. So this puts every one of us, both the leadership and the followership, under pressure. Pressure is required for building capacity that drives the exponential growth and success. So stress, pressure in themselves are not bad, are not outrightly bad. However, they have to be well managed. This is where the balance for this discussion comes. So leadership is a great idea for any one of us in this training who have set out to be a leader, either by virtue of you find yourself in the position, or you even work your way consistently into it, or it was done to you by inheritance and you just find yourself in leadership. The goal is that you must craft audacious vision. For this vision to become manifested, to become a reality, then you need to engage the battle, in a battle against nature to make things happen. To engage in this battle, you need to build capacity. To build this capacity, you need to put yourself under pressure. When you put yourself under pressure over a sustained period of time, you're going to be able to build strength of character, strength of competence, strength of compassion, strength of courage. You're going to be able to build ultimately this consistent strength that keeps you going in the face of adversity. Now, resilience is needed because there are sometimes life will knock you down and you need to jump up back. You need to jump up with a lot of flexibility, humility, and you need to keep going and achieving great success. To do all these, you will go through stress. You will go through some days of mental exhaustion. You will go through some days where your mind would question you. Why are we actually doing this? So that's why mental health is important. Why is mental health important for effective leadership? I have here saying that for you as a leader to make effective and efficient decisions, for you to even be able to communicate effectively, for you to be able to inspire your team, there are 4 key qualities in transformational leadership that we commonly discuss. Bernard Emba discussed this extensively. The first one is we talk about inspirational motivation. We talk about idealized influence. We talk about intellectual stimulation, and we talk about individualized consideration. For you to achieve these 4 transformational leadership ideal, you need a clear mental status. Because idealized influence means you have solid character and you have defined your value system clearly. And that would inform the quality of decisions you would make. That will inform the quality of words that comes out of your mouth to communicate effectively and to inspire your team for inspirational motivation. So, leaders that are under chronic stress or burnout, they often struggle with focus. They struggle with emotional regulation. They have problem with thinking for long, strategic thinking, their capacity to narrowly think for long. This will negatively affect their performance and even drop the team morale. We all watch soccer. We see games where the players have issues with the coach. You see how the team weekend on weekend consistently come out with poor results. Because the team isn't focused on the long-term goal again, there's emotional dysregulation in the team. Everyone is struggling to find their position in the heart of maybe the coach or the leadership of the club. So this also happens in different organizations where we work. People decide to form caucus, cohorts, groups. That's when you have people on the side of Dr. A and another group on the side of Dr. B, and then gossip starts sipping in and other things starts coming in. These are features of chronic burnout in the system where everyone is just trying to struggle for survival instead of fighting for significance and even sustain greatness in the organization. So if we prioritize mental health, we will help leadership and even followership to maintain clarity. We would build resilience. We will be able to build empathy, the capacity to feel the emotions of others, understand our own emotions, and be able to find an excellent balance between the two, and leveraging this to define and design how people will become great. And then we'll be able to foster a work environment that supports innovation and productivity, which is the goal of every great organization. I put it to you this afternoon, stress is real. Either acute phase, which is sudden, people lose loved ones, maybe even people lose a lot of things. Some lose their licenses, some have, imagine a doctor that is going through a medical litigation case. That's an acute phase issue. But we also have a long-standing issue, which is chronic. This can lead to breakdown of various forms, and I'll talk about this in a bit. But I want you to accept and absorb the reality that as an individual, you may actually be even going through some degree of depression at one point or the other. And you really may not be able to classify it. Anytime you notice that you now become more interested in things you usually don't necessarily become more interested in before. Some people now become more interested in seeing African magic for longer hours. Some eat too much. Some sleep too much. There will be weight gain in some. Some become starved and they don't even eat at all. When you notice sudden disruption. Maybe you now become low energy. You now give low energy to the things that used to excite you before, that used to make you enthusiastic. Or maybe you even stop the fight for greatness, the fight to push harder. Then you may actually be under some chronic chronic form of stressor. And this may be features that you really need to sit down and examine in your life personally, or maybe on any member of your team. You just notice they become all of a sudden too quiet. Someone that used to be excited, that used to call you, let's go for lunch, let's go to break room or something, all of a sudden becomes disconnected, all of a sudden starts keeping to self. By the time it gets to keeping to self, then it's becoming a more dangerous thing that you really need to speak to leadership, speak to HR team about, and ensure that actions are being taken. Or maybe consistently, someone that used to be an high performer in the organization, all of a sudden the performance starts dropping. And you notice that they don't even care. For some, you will notice their dressing starts changing. Someone who used to be on a good suit before, nice, well-suited, kit-head personality, now becomes someone who doesn't care. His tie is dripping, his belts are not properly fit, his shoes are dirty. Someone who used to be a fashion-conscious person, now all of a sudden start losing the sense of combination of cloth or clothing. Then you should pay attention to all these changes, especially you as a leader, or even a departmental or a functional leader in whatever form or capacity you are. When you notice changes like this, then you should pay attention. Someone who used to be courteous before, when they greet you, when they meet you, they greet you. All of a sudden becomes someone who passes you by, doesn't even show any sign of energy or life, doesn't even care if you greet him or if you're greeted or not greeted. When you start seeing all these differences, then it speaks to you in clear volume, in clear terms, that this person is under a major stressor, either acute, chronic, or acute or chronic in some cases. So these are reasons why, as a leader, you need to pay attention to your environment. So I bring to you that how do leaders identify signs and symptoms? Signs and symptoms of how do leaders identify signs and symptoms of stress or burnout in themselves and their teams? The first thing is you need to know what's the difference between a sign and a symptom, right? A sign are things you would see physically. Symptoms are what the person will feel personally. So when we talk about signs, if either you as a person, if you notice anyone showing some difficulty concentrating, they become irritable, exhausted, loss of enthusiasm, I've listed a lot of examples. Or you notice increased absenteeism or late coming. The person doesn't really care about the promptness to work again. There's a decreased productivity, disengagement from general conversation, or maybe the person is just throwing tantrums and there's conflict among team members. They just unnecessarily become argumentative, or they flare up at the onset of anything. Then these are clear signs to you that this needs to be addressed as a leader. Physical symptoms, maybe fatigue in yourself. If you start feeling you don't have the joy towards your work, insomnia, inability to sleep well, frequent illnesses. People just give excuses of malaria, typhoid, fever consistently just to shun or avoid work. Then people become irritable, depressed, show some work apathy. All these, including behavioral symptoms, social withdrawal, and some may result even into substance abuse like alcohol intake, excessive intake of alcohol and other social drugs. When you notice all this, then this answers the question that you may really need to pay attention to yourself or to your team member. I listed this breakdown for you to have an idea. There are 7 of them. Physically, you may notice all this. Mentally, people become more anxious and there are some panic attacks. Cognitive breakdown, they start making mistakes. Someone has been used to handling a machine, using it effectively well before. Now start making mistakes in handling the same machine they've been using for years. And that means there's some difficulty concentrating. There's some social breakdown. Their friends, they withdraw from friends, they strain relationship, they just don't care. And then there may be professional breakdown, behavioral breakdown, And the most important one I needed to pay attention to is the psychosomatic breakdown, where people start having unexplained physical symptoms. They just start complaining about pain in a certain part of their body. That after taking several analgesics, or weeks over weeks seeing a doctor, they just keep saying the pain doesn't go, the pain isn't going. I used to have the staff that reports to us many years ago, like 8-9 years ago, like that. She always complains about GI problems, peptic ulcer, describing the form of peptic ulceration pain. She talks about her epigastric pain radiating to the back, preventing her from sleeping well, weeks upon weeks. She saw a gastroenterologist, after a while we had to make her say behavioral scientist and everything, and she got out better over time. But it was because of working in an environment where there were clinicians and we could reason things out, both from the psychosomatic form and from the organic form for us. So what I'm saying is, by the time you start having patients maybe staff members, followers, complaining about worsening chronic conditions, then this will tell you to pay attention to the stressors and stressing your environment and reevaluate the way your work is. So I said, are there strategies that leaders can use to manage their stress and still build resilience in their team? Yes, there are great ways to manage stress. The truth is, we are all under stress to the degree, and another beautiful thing is we have different capacities to handle stress. So what you may see as fun may already be a stressor to another person. What you may see as I'm enjoying this is helping me build character, it's helping me build capacity. Some would see as this is killing me, this is injuring my life, this is destroying my family. So you have to understand as a leader that we all are not operating on the same capacity level. Another important thing that I would love you to notice is that because of the experiences most of us have had, the capacity to be under pressure will be different. I can imagine myself now being subjected to some academic rigor. There is a very fairly high chance that I will still keep going when so many people would say no. The reason is, right from medical school, I've subjected myself to a lot of academic rigor and still did several other things with it. So, because of prior capacities people have built, you would expect some people to carry more capacity to keep going. So, for those of us who have the better capacity, it's part of our responsibility to help those who have lower capacity. That's where I'm actually going. So if you think you have strength in an area, no matter what the pressure is, you're able to diffuse the situation, then you may be at a better stance to help in terms of pressure. So time and energy management is crucial. A couple of weeks ago, my wife had to call my attention that one of my staff in Nigeria, that I really don't pay attention to the fact that when I share something on the work day, it's actually their own time later in the evening. I'm 7 hours away from our timing from Nigeria. So, because my wife has to call my attention to it, I have to now set a boundary. I now clearly say, don't worry, whenever I drop anything on the work day, do not worry, just take care of it the next working day. So don't be under pressure to execute it that evening, lest I eat into your own personal time. So that's one excellent way to manage people's time and energy. Otherwise, if you burn her out over time, she gets frustrated and she's not interested in the job again. So as a leader, you have to pay attention to when you set clear boundaries. If I have a state assessment coming up in next week, and we still have a lot of documents to tidy ahead of the assessment, everyone would understand that these are crucial moments, and then we can factor that. But immediately after the assessment, we can tell ourselves a day or two, take it off, so that you can do other things to prevent burnout. Mindfulness practices like meditation, breathing techniques also help with reducing stress. Yoga, encourage exercise, gyms. People should go and work out. This helps with physical health and also help balance their mental health. Encourage adequate, healthy diet, regular exercise, and ensure you talk about good sleep. Create a support system in your workplace where you have trusted networks of peers, mentors, coaches who can advise. Professional help is excellent. You can get a therapist, a counselor, to come around from time to time to discuss with people. I know some organizations where you need to get clearance from the counselors, the psychologists, before you're even allowed to resume. And from time to time, you get reevaluated, especially when you go through some crucial life-changing scenarios, like some people, after they give birth, their lifestyle changes because now they have to cope with their kid and the job. Or some people even after marriage, just because they got married now, they have to take care of the family, unlike when you have a spouse that's still single. So you have to pay attention to when people pass crucial moments. Some people, when they lose their parent, either of their parent, those are crucial moments where you need to help them and support them. So as a leader, your responsibility is not only limited to the job. You're not to pay attention to everything that happens to your staff because you have a direct relationship with the productivity in your organization. Then the most important thing is for you to ensure that you always advocate for growth mindset in the organization. When you advocate for growth mindset, people's understanding changes. They want to develop themselves better. In the bid of developing yourself better, you learn about better tools, better relationships that can help you get something done faster and cheaper sometimes. So I remember many years ago, when I used Excel, I just used it for a simple function. But with time, I learned about other codes writing in Excel, like using VLOOKUP, concatenate in Excel and other things, pivot table, and all those things help me deliver my job faster and better. So just to make you understand that by the time you have a growth mindset, even some things 5 years ago, 7 years ago, you call challenges, may really not be a challenge because there's a solution around that can help you conquer that. You only did not know about it because you probably are not developing yourself up to. So I just brought this picture to make you come to life for you. Make sure you introduce self-care, stress management classes in your organization. Create time for wellness classes, wellness programs. As a leader, you can organize and design these things around that even people can pay out of pocket themselves. You work with some gym instructors, work with different people, just to ensure stress is properly managed in the organization. And all this will lead to excellent mental support. So I also wanted to elaborate more about the support system that I know has happened here in the United States and even maybe few that I've seen back in Africa. The most important thing is to build a trusted network of peers, mentors, and coaches, where when someone is going through an issue, they can actually walk freely to you as a leader to talk to you about. But that means you as a leader too must be a person of character, must be able to keep their secret, confidential. You must manage relationships properly, and you don't leverage the information you know about someone to take advantage of them. If you use that at a point, you will lose the character advantage, and they will never be able to trust you again. But most importantly, these regular check-ins with team members. This even happened to me on my current program that I'm running. 15 minutes every Tuesday. I have my program lead come to me. We just gist about, sometimes we gist about family. Sometimes we gist about the job. We gist about different things. That 15 to 20 minutes from week to week helps you as a leader to know your team member. So please, if you have not been doing this before, weekly, touch base with the key figures in your team, as many people as you can touch. And if you cannot touch everyone, create a strata where maybe you are talking to like 5 people, and some 5 people are talking to another 5 people under them. So with that, you're talking to 30 people automatically. Because you're talking to 5, those 5 are talking to other 5. So let's say you have a very large team. So those 5 are talking to 5. Then the 5 under can also take care of 5 as the cadre or the strata of leadership goes down. And if there's anyone that is found that now needs a particular attention, then they can refer that person to you. That minimizes your own mental health issues too. Allowing mental health days where you discuss about mental health, bring up consultants, do a workshop on emotional intelligence, then create a system in your organization that allows for anonymous feedback systems. Where people can drop feedback and make sure you really read it, analyze the information, get to the root of the matter, solve the problem. If you don't solve the problem, people will lose faith in the anonymous feedback system, and over time it will just be a box. Create wellness programs and mental health resources that are available in your environment. Then create recognition system. Reward employees for their contribution to boost morale of others. Any employee that you find enthusiastic, always encouraging others, reward them. Pay attention to them and reward them. Then organize trainings for your managers and your leaders about mental health concerns from time to time. That would go a long way to help. Then another thing is, as a leader, as a person, how do you encourage a culture of empathy and psychological safety in your organization? Because now this now boils down to you in person now. A leader must model vulnerability. You must openly discuss your own challenges and encourage employees to do the same. So I made some mistakes and I come onto my team and I said, look, I'm going through a lot this week and it's really wearing me down. I'm going through a lot on the family front and it's really wearing me down. And because of that, I'm not able to catch up with all the approvals I'm supposed to give this week. And then you can get someone to support you. When you talk like that, when the followers are also going through issues, they will be able to come and meet you that, I'm so sorry, sir, I'm also going through stuff. Maybe I want to write a professional exam. I couldn't concentrate. I need to take a day or a week off so I can people will now become more vulnerable to explain to you. But when you're the leader that is always raising your eyebrow up, you don't listen actively to your employees, you judge them, you interrupt them before they even complete their sentence, then you will lose this vulnerability concept and then you would have blocked the way for open communication. So you must create a system for open communication in your environment, ensure you actively listen, model vulnerability, provide training, and even you as a leader, make sure you attend training on empathy and emotional intelligence. Like I said, YouTube is your friend. There are thousands, tens of thousands of videos, training on empathy, emotional intelligence for leaders on YouTube that you can actually listen to for free. And if you want to take other courses on it, go with me. There are so many courses on Coursera, Udemy, etc. that can help. But most importantly, you can leverage the free ones on YouTube first. And then if you think you need more, talk to counselors, psychologists in your environment. Then create an environment with policy where everyone has signed that prevents harassment or toxic behavior. No one should bully anyone in any workplace. Not even because you're the boss. Not because a doctor must not bully a nurse. A doctor should not bully a pharmacist or a lab scientist. Just imagine the ranks. Director should not bully deputy director. Deputy director should not bully secretary. There should be no bullying. If I do something wrong, just call me with empathy, discuss with me what I did wrong, support me to get it corrected. That should be the goal of every leader. Not to harass, intimidate, oppress, scream out, shout out, yell on anyone. If you're doing that as a leader before, it is wrong. So you have to celebrate successes, both big and small, to encourage people to keep going. So we are getting low on time. Leaders must integrate balance into their routine. You must ensure you delegate. You must trust your people with responsibility. Avoid micromanaging. Even when you know they won't do it perfectly like you will do it, please still allow them to do it. Over time, they will learn to get better. And then provide support. Set boundaries. Clearly define the time of work and the time for overwork. And let them know if the overwork would have remuneration, and if it would not, then please create a system to recognize them publicly. Prioritize their breaks. Ensure there's regular breaks, vacation for people to relax and recharge and come back better. Incorporate flexibility into the way you do work. Don't just be a rigid leader who will just say, this is how they've been doing it 10 years before I got here. It has to continue that way. No. Think with your team. Find other ways around to make things happen in a better, faster, cheaper way. Think about it. Are there softwares that can get this thing done that I don't need to put all this burden on you? Then focus on the long-term objective. Don't just be caught up on it must be done tomorrow, even though maybe the submission of that thing is in 3 weeks' time. If you think there's still some flexibility on the goal, then allow people the breather. Don't just force your own opinion on the team in the bid of trying to say you're achieving goal faster. So I brought this here that please always have time with your team. Talk about mental health. Talk about it. Explain to your team. Ensure that you have conversations around stressor, mental exhaustion. All these are feelers you must get back from your team from time to time. I'm not saying you should build a lazy team. I'm only saying you should build a more efficient team that you're actually prioritizing their mental health. To lead sustainable success for leaders and the organization, you need a better decision-making process. I shared yesterday on how you can use data to make decisions faster, especially when you leverage data analytics. But don't forget, you have to integrate this with a functioning team. And that's why it's easy to build an excellent team and then leverage data. When there's increased productivity, we always tend to get more happy, although that's also the time people get burnt out the more. So you need to pay attention and check the balance. You need to check your staff turnover rates and look at the culture of your employee, how well your employee love what they do and how they are doing things. You need to love innovation, ensure there's a creative and collaborative environment. And then always talk to your employees about long-term fulfillment, things the company has in stock for long, so that it can help build greatness into their subconscious and they know the reason why they are fighting. Example here, I said the technology company promotes mental health initiative, would see reduce absenteeism and increase innovation. And that would lead to a competitive edge in your market. So please don't forget, enhance decision making, increase productivity. All these things are what leads to sustainable success for leaders. You need to fine-tune your process of data-based decision making. And that will help you make decisions faster, fairer, and with minimal emotional bruising, because you show people the data and they will know that it's not because I offended you yesterday, that's why you are going against me or increasing my workload. They will see that it is the data that is speaking. I want to thank you so much for this opportunity. I am leaving this remaining minutes. If we have any question, we can take it in the 5 minutes that we have. Thank you so much. Hello, sir. Do we have any question? Hello?
I didn't know I muted my voice. Please go back to your details on your, okay. Don't worry, your details page, your contacts and all that.
Okay, yeah, sorry, I'm trying to bring the slide on. Okay, just a moment. I don't know why it's not popping up. Okay, let me close this and then stop sharing. Share. All right, so the details. All right.
All right, it seems we are perfectly okay with session.
Yeah, no one has not something you're going through currently on at your workplace that you really want to share, or something you think you might need some insights about.
Perfect. So I'm leaving the details on the screen so that for personal feedback and any consultation can also be done. And I'm sure I'm saying openly, we're also going to have access to the slides. Yes, this slide is already available. So this short slide is also going to be made available. Dr. Joshua, thank you so much for your time. I know you have a lot of work for a busy day. Thank you for being part of this session. We really appreciate your time you have given out to be part of us. Thank you so much, sir.
Appreciate it too. Thank you so much.
All right.
Bye, sir.